Good morning. I call to order the special meeting of the Health Services panel. We have formed a quorum. For today's agenda, there's only one item. We'll be talking about the prevention and control of coronavirus disease 2019 in Hong Kong. At this moment, I would like to invite the administration to join us. Please stay in your assigned seat. And if you would like to ask questions, we will invite you to speak in according to the order that you press the button request to speak. For public officers in attendance, we have the Secretary for Food and Health. We have also got public officers from the Education Bureau, Home Affairs Department, the Security Bureau, as well as the Government Logistics Department, and the Constitutional and Mainland Affairs Bureau as well. I would like to welcome the administration for attending today's meeting. I would like to invite Professor Sophia Chen, Secretary for Food and Health, to walk us through the paper briefly. Professor Chen, please. Thank you, Chair. Thank you, Deputy Chair. Good morning, Chairman, Deputy Chairman, as well as members. Let me update you on the latest position as well as the measures introduced. On the 10th of January, 30th of January, as well as the 18th of February this year, I submitted papers to the panel so as to brief you on the prevention and control of coronavirus disease 2019 in Hong Kong. Since then, a lot has happened. So I would like to brief you on the latest situation as well as the measures. First of all, a word about the global situation. We noticed that the outbreak is continuing all over the world. As to the number of cases confirmed in different countries, it is a rising trend. According to the World Health Organization, as well as the National Health Commission, as at the 8th of March 2020, the number of confirmed cases reached 80,735, an increase of 40 compared to the day before, with 3,119 cases of fatality. 67,743 in Hubei, 36 more than the day before for Guangdong province. 1,352 cases confirmed altogether without any new cases. Of course, while I'm speaking, things are still fluid. The number of cases confirmed will change. As of 6 p.m. on the 9th of March, we saw 3,525 more cases confirmed in places outside of mainland China. We have also made inquiries about other countries, and we have issued a red outbound travel alert against a number of places. For Korea, reported 7,382 cases, 248 more, with 51 fatal cases. For Italy, 7,375 cases, an increase of 1,492 with 366 deaths. And then for Iran, 6,566 were reported, an increase of 735 and about 194 fatal cases. Well, as I have said, the outbreak has been developing rapidly. So I'm merely reporting to you on the latest figures. Probably at this moment, there are already some changes. We understand that we need to monitor the global developments, and we will introduce appropriate measures. Again, I would like to appeal to the public, please consider postponing unnecessary travels. As the local situation, as at 8 p.m. on the 9th of March, we had a total of 115 confirmed cases with one probable case. Among the cases, 3 patients passed away and 60 patients upon treatment have been discharged. Of course, as far as the control measures are concerned, they will continue. All the decision-making policies, bureaus, as well as departments, together with the hospital authority, we have been stepping up our efforts on all fronts in preventing and controlling COVID-19. We have been strengthening the port health measures. Other than the routine measures at the boundary crossing points, like the body temperature checks at the airport, as well as the health declaration arrangement at the land BCPs. Starting on the 8th of March, we have extended the requirement to all incoming travelers at the airport. On the same day, we have started to introduce the electronic notification system for health declaration. Secondly, we have strengthened the immigration control and outbound traveling alerts. A number of places are subject to our health advice. The mainland, France, Germany, Korea, Italy, Iran, etc. Well, in the light of the outbreak in certain regions of Italy as well as Iran, we have already issued a red OTA. And in fact, for travelers coming from such places, we've issued quarantine orders, and travelers from such places will be sent to quarantine centers. Well, of course, the outbreak in the world is changing all the time. We will make adjustments to the measures in the light of the WHO advice. And then, in view of the latest local and global situations of COVID-19, the Department of Health Center for Health Protection has been continuously updating the relevant reporting criteria to enhance surveillance of suspected cases. We have already expanded the enhanced laboratory surveillance program so that the A&E departments, general outpatient clinics of hospitals, as well as private clinics and private hospitals are also being covered so that we can lower the risk of community transmission. Well, regarding the milder cases in the community, in order to have a better picture of the epidemiological developments, last Friday, in other words, on the 8th of March, we wrote to private doctors and private clinics asking for their assistance in collecting samples. And we are going to make arrangements for laboratory tests for the samples free of charge. And then we have been improving facilities and services. The government will continue to select appropriate places to set up quarantine centers and other facilities. And then for the clusters under the hospital authority, again, they will monitor the situation. And then, if necessary, other facilities will be retrofitted to become infectious disease wards. For CAP 599C, it came into effect on the 8th of February 2020. We know that we have Hong Kongers staying in Guangdong Province and Fujian Province. They are not able to return to Hong Kong to refill their prescription and to attend follow-up appointments. On the 24th of February, we launched a special scheme so that for Hong Kong citizens or Hong Kong residents residing on the mainland will be having their medicines delivered to them. And then we would like to prevent the spread of the disease. On the 27th of February, we announced that subject to targeted social distancing and with special arrangements and precautionary measures to be taken, the government would gradually resume more public services from the 2nd of March 2020 onwards in an orderly and progressive manner. In this connection, the government departments have been implementing targeted measures to reduce social contact. And in fact, the government has decided that classes would remain suspended and they would not resume before the 20th of April. For public events of a large scale, again, they will be called off. And then we have set up the Anti-Epidemic Fund. On the 21st of February 2020, the Legislative Finance Committee approved the injection of $30 billion into the Anti-Epidemic Fund. Departments and bureaus will introduce and implement the 24 measures under the fund as soon as possible to provide support to enterprises and members of the public. $4.7 billion will be provided to the hospital to support its work, in particular to make sure that the frontline staff will be given support. And in fact, under the HA, if necessary, a special rental allowance will be provided to staff working in high-risk areas with temporary accommodation needs under the emergency response level. So we're talking about a special rental allowance, and there is also a special emergency response allowance to provide recognition to their work. And then we need to carry out the tracing work. Currently, we have got 81 close contacts, having arrangements for quarantine for them. Another 202 are under medical observation. Now, we'd like to increase the supply of surgical masks. We'll continue to spare no efforts in sourcing surgical masks globally, and we are going to promote local mask production. And then when it comes to the allocation of masks, healthcare workers will be given priority, as well as officers engaged in necessary public services. Under the Anti-Epidemic Fund, we have the local mask production subsidy scheme, and will provide financial assistance to facilitate the establishment of surgical mask production lines in Hong Kong. And then the 10th item is about the risk communication and transparency. The CHP and HA representatives are holding daily briefings. In addition, we have also launched a thematic website so as to provide information on a single platform. We have also got the interactive map dashboard, as well as the Hong Kong Anti-Epidemic Information Channel, so that the public can get the most up-to-date information. And then we've been liaising with mainland authorities and international cooperation. We'll continue to maintain close liaison and cooperation with the mainland authorities as well as the international community, like the WHO as well as the APEC. We've been showing care and engaging the community. The HAD as well as the district officers have been providing hotline service to those affected. We provide support at the district level. We engage in public education, and we encourage the members of the public to join us in the fight. For specific incidents, probably you understand and remember that we have chartered flights to return the Hong Kong residents on the Diamond Princess cruise ship, and then as well as the Hong Kong residents in Hubei province. They have been arranged to stay at quarantine centers for 14 days. We'll continue to help Hong Kongers who are still in Japan and Hubei. We understand that both members as well as the public are concerned about the latest developments as well as the response of the government. We'd like to take this opportunity to listen to members and take questions from you. together with colleagues from other bureaus and departments, we are happy to take questions from you, and we aim at fine-tuning our measures.
Thank you, Secretary. Other than the Secretary for Food and Health, we also have representatives from the Department of Health, Security Bureau, the HA, the Constitutional Maintenance Affairs Bureau, the HAB, and also the LCSD, as well as the Logistics Department, the SWD, and the Commerce and Economic Development Bureau, as well as the representatives of the Education Bureau. So members may ask them questions which are of concern to you. We're scheduled to finish at 10:30, so we have plenty of time. And I intend to allow each member 5 minutes. I'm going to read out the names of members who wish to speak so that you know when it's your turn to speak. Helena Wong, Yip Pin Yin, Lo Wen Kwok, Elizabeth Kwok, Eunice Chen, Pan Xiu Ping, Lee Kwok Lun, Bernardo Zhang, Xiu Kao Chung, Chen Po Yin, Alice Mack, Huang Chun Yu. We'll begin with Helena Wong. Thank you. I think the epidemic is still in a very serious state. The price of surgical masks is still very expensive, and globally there has been an increase in the number of confirmed cases. In some countries, they're not able to conduct, checks on their residents, so we don't know whether or not, there are any confirmed cases. So right now, the epidemic has spread to 96 other countries, but the government is still reluctant to close the borders. The airport is still open. Throughout the world, the epidemic is spreading, and Hong Kong is still, has not yet closed all its borders. So what I'd like to know is whether or not you will seriously consider closing all the border points. If you don't do that, with so many people flying to Hong Kong, and in their own countries, the epidemic is already spreading. So if you don't close the borders and you only require people to fill in a health declaration form, so what else will you do? What other measures will you adopt? Because these people will still be, going around in our community. So eventually the community outbreak will become, out of control. So how are you going to ensure that the airport will not be open to anyone who come in? If you don't just rely on the health declaration form, I don't think it's very useful. Secondly, for those who have come to Hong Kong, many of them are now subject to, quarantine at home, or some will quarantine themselves within the hotel for 14 days. The home quarantine list you indicate on your website is not updated daily. So I'd like to ask the government, how frequently will you update that day? Why is it that you cannot provide a daily update telling us in which particular building, in which particular district where there are people who are subject to home quarantine? And why don't you provide a list, according to the 18 districts? The public has the right to know. People, the property managers who also has the right to know, because they need to know which of the buildings under the management have new cases of of people who are subject to home quarantine. Why is it that you don't inform the HAB so that they can get in touch with the owners corporation? Why won't you let the property managers know which buildings in which buildings your residents are subject to quarantine, so that they can actually enhance the sanitation of those buildings and that the residents in those buildings can be alert? Dr. Wong, are you asking the Secretary whether or not the government will adopt a total closure of our border control points? Thank you, Dr. Wong. I think we all remember that earlier there was an outbreak in the mainland. In late January, the government had, in the light of the epidemic, adopted various measures. We were at that time in Hong Kong and the mainland well, we were steadily, reducing the human traffic between Hong Kong and the mainland. At different border control points, we adopted various measures. So we did not just impose the health declaration requirement. There were other measures adopted. And we've integrated the border control points. And as far as the mainland is concerned, of course, the Shenzhen, I don't think you should beat around the bush, Madam Secretary. You're still opening the airport to international traffic. There are now 96 countries where the people can come to Hong Kong. But on the one hand, we know we are continually monitoring the human traffic. But if you look at the flight schedule, I don't have the information offhand, but there is already a drastic reduction in the number of flights. We have also issued OTA alerts. There are 3 countries which are subject to the red outbound travel alerts. The Department of Health has also appealed to people to delay or postpone their outbound travel plans. And when Hong Kong residents return to Hong Kong, when they return to Hong Kong, and if they come from various countries such as the mainland, they will be subject to various surveillance, control measures. In other countries, I think those returning to Hong Kong from those countries, people who return from those countries to Hong Kong will also need to be subject to home quarantine for 14 days. Your second question is about the list of buildings where people are subject to home quarantine. I'll ask the director to answer the question. Regarding home quarantine, according to Cap 599C, anyone who has been to the mainland in the past 14 days will have to be subject to a home quarantine. And these people, I think we need to understand, may not have any symptoms, and when they cross the border, they've made a health declaration. I think Dr. Wong is asking whether you will update that list. Well, the number of cases we process every day is quite large. There have been more than a few thousand. How many recently do you have? On a single day, the number could exceed 2,000 or even more. We want to collate the information as soon as possible because at the moment we need to actually verify the numbers before we input them and put them onto the website. As for the confirmed cases, not all of them will be subject to home quarantine. We have a dashboard, and the public may actually find out the distribution of these people who are subject to home quarantine. Dr. Wong would like the list to be more updated, and we promise to do that. So you have more than 2,000 people subject to home quarantine on a single day. I'll ask my colleague to further follow up on that. So you don't know how long it will take before you update the list. I think Dr. Wong, I don't think you've actually answered Dr. Wong's question. First of all, a number of people arriving in Hong Kong by plane. Could you give us the most updated number? Perhaps you can provide that information later on. Regarding the surveillance list, how frequently is it updated? And secondly, for those buildings where there are people who are subject to quarantine, would you inform the Owners Corporation and the Property Managing Agency? I think the Center for Health Control had all along been in close contact with the HAB, Mr. Ip Kin Yuen, Chairman. Last week, the government, sent a charter flight to repatriate more than 4,000 Hong Kong residents to Hong Kong, and I think that is good news. But we also know that in Hubei, that is outside of Wuhan, there are still more than 2,000 Hong Kong residents who are now in different parts of the province. To repatriate them would be a very difficult task because these people are spread out in different, places, and it's very difficult task to take them to the airport and repatriate them to Hong Kong. But they have been waiting for a long time. It's been more than a month since January 23rd, when you. Of those in Hubei, many of them are, kindergarten and primary school pupils. You have people who are only children who are, for 3 or 4 years old in Haogam or Xiangyang. When will you take further measures to repatriate these residents from Hong Kong, including young children coming back to Hong Kong? Secondly, it has been reported recently that candidates for the DSC examination will be issued surgical masks. That is a very important step. But there has also been reports that we have isolated incidents where people reported that the surgical masks have stains on them and they could have, they could be past the expiry date. So I'd like the authority to tell us about the state of these masks so that the candidates for the DSC exam can have the confidence. Thank you, Chairman. Thank you, Madam Chair, and thank you, Mr. Yip. I'll give a global response and I'll ask the Secretary, the colleagues from the Constitutional and Main Affairs Bureau and the Education Bureau to supplement. Mr. Yip, I think you know that 469 people from Hong Kong have been repatriated. It is indeed a very difficult task. We need to make a lot of preparation beforehand. I'm sure the Constitutional and Main Affairs Bureau is already thinking about how we can repatriate the other Hong Kong residents who are still in Hubei, because not all of them are staying in Wuhan. So we need to come up with transport arrangements because before these people can take the flight back to Hong Kong. For the 460 odd people who have been repatriated already, some of them are students. Perhaps I can now ask the Constitutional and Main Affairs Bureau to further supplement. Mr. Yuen, Madam Yuen, or Chairman Yen from the Bureau. First of all, I'd like to thank the Chair and the member for their questions. Last week, we sent 2 charter flights to Wuhan, and we repatriated 469 residents from Hong Kong back to Hong Kong. 390-something were residents stranded in Wuhan. We also took another 40 residents from Hong Kong who were staying in other parts of Hubei and who need to return to Hong Kong urgently, including those candidates who will be attending the forthcoming DSC examination. We're concerned about the condition of the Hong Kong residents in Wuhan. We understand that they are very anxious to come back. So we hope that we will be able to announce the details regarding the next charter flight. We will continue to liaise closely with the Hubei authorities. We will, based on we will repatriate Hong Kong residents from in other parts of Hubei back to Hong Kong according to a priority list. For those Hong Kong residents who have special or particular needs, our Wuhan liaison office will continue to liaise with them and provide, all the necessary support. Perhaps the Education Bureau can answer the question regarding surgical masks for DSC candidates. Madam Chen Ji-Wen, thank you. Regarding surgical masks, actually they are supplied by the Logistics Department. So our Bureau is not yet able to confirm about the state of those surgical masks. We will further liaise with the Logistics Department about that. So if the masks have expired already, it will be a health hazard to the candidates. I'd like to ask the Education Bureau to find out and then announce make an announcement to the public so that they can be rest assured. Dr. Wai Kwok. In the midst of the epidemic, one important task for the government is to disseminate the right information, whether it's the number of confirmed cases, the number of patients who have recovered. Such information are very important. We also information regarding incoming and outbound travelers, and also outbound travel alerts, and also which residents from which countries will be subject to compulsory, quarantine and so on. So I think Hong Kong is actually many steps behind Macau. I think in Macau they already had set up a dedicated website for this purpose, but in Hong Kong has been very late in setting up this website. Although the website of the Center for Health Protection already disseminated the information, but I don't think. But as for a dedicated website providing the information from all departments, something else. While it is. But I think while you've launched it, at a very late stage, but it's still a good move. But I think that the website should provide more information. For example, it could provide the number of outbound and incoming, visitors, and number of people who are subject to home quarantine. So I think you can provide more such information on that website. During this epidemic, I think one thing which we are very disappointed about is that there have been plenty of fake news, so that the public would need to take care of the personal hygiene and take precautionary measures, and to cope with the economic downturn. At the same time, they are subject to the influence of lots of fake news. So, a source of, accurate information, therefore, is very important. So I think I can certainly help you to promote this dedicated, website, which is the COVID-19 thematic website, or the corona, virus, .gov.Hong Kong. So my question specifically is that at different stages, the epidemic in Hong Kong is changing, ever changing. Initially, we had imported cases from the mainland. After a while, we no longer have imported cases from the mainland, but we have, particular, clusters of groups in Hong Kong, like the Buddhist, shrine in North Point. But there has been a new concern recently, that is, we're beginning to have imported cases from abroad.
Say, for example, we have got 12 members returning from an Indian tour group. I'm not sure whether my information is right. I think 5 of them have been infected, quite a large proportion. But in fact, India did not appear to be a country with a large number of infections. Our attention has been focused on South Korea, Iran, and Italy, because the number of cases identified went up rapidly over the past few days. Now, of course, in relation to the outbreak on the mainland, we see that it is being brought under control. In the case of Hong Kong, with the efforts across the city, and despite sporadic cases over the past few days, we aren't getting an outbreak like that in our neighboring cities. So probably we'll see a new wave of infections, that is, cases imported from other countries, and we need to act against that. Of course, Professor Chen has touched upon that. However, I want to know whether you have got a dedicated team to deal with this new development. So, what is our question? I would like to know how Hong Kong copes with the risk of imported cases. So not just about the local situation in general, but specifically against the risk of imported cases. Professor Chen, Dr. Low is right. Other than the outbreak on the mainland and the local situation, we've been watching the development in the rest of the world. Recently, we've noticed the number of new cases outside China. In fact, they are getting more cases than the mainland. And in fact, it is a drastic increase. For the CHP, under the Department of Health, they've got a dedicated team to monitor the developments in different countries. They won't just be looking at places where there has been a drastic jump. Against such places, of course, we need to introduce specific measures like outbound travel alert, as well as quarantine measures for incoming travelers. Even for places which have got a lower number of cases, like India, as referred to by Dr. Low, we are also paying attention to different countries and places. On a daily basis, we are assessing the risk. We look at the number of cases, the rate of increase, the absolute number of cases, the number of fatal cases, as well as the outbreak at the local level. And then we also take into account the public health system and their control measures. Of course, we'll also look at the countries and places that Hong Kong people would like to travel to and frequently. Maybe the Security Bureau can provide some figures for us, like the number of arrivals from the mainland. Yes, perhaps the SB can answer the question. Thank you, Chair. In fact, we do give you the figures at the website of the Immigration Department. We have the Hong Kong-Zhuhai-Macau Bridge, Shenzhen Bay Control Point, as well as the Hong Kong International Airport still in operation. As of yesterday, 9th of March, 10,633 arrived. 8,304 were Hong Kong residents. So when we try to compare the average figures for January at the international airport, at that time the average was 57,000. In other words, you have seen a drastic fall in the number of arrivals. We have also got a dedicated web page for OTAs, outbound travel alerts. As Professor Chen has said, we do encourage citizens to postpone unnecessary travels. In that way, we can reduce the risk. Well, I think you should also include such figures in the dedicated thematic website. Next to ask questions would be Dr. Elizabeth Quat. Thank you. Well, the disease is still spreading. In the past, we were worried about cases imported from the mainland. Currently, we are concerned about infected arrivals from Iran, Italy, etc. Now, I understand that there will be compulsory quarantine for such arrivals. I do welcome such a decision. Well, other than Iran and Italy, the outbreak is also going on in other places. So I think the government should act in time and step up your quarantine measures. I would like to turn to the question of surgical masks. It seems that we have seen an ease in the supply of adult surgical masks. Many people found the prices beyond their affordability, but parents are complaining that they are not getting the masks for children, especially younger children. If they don't have a mask, they can't go out, and it means that we cannot resume classes. So in relation to the procurement of masks, do we intend to cover children's masks as well? Are you going to supply masks to school children so that they can have a mask when they go to school? If you have, how many of them? And then for expectant mothers, they have to attend antenatal checkups. So I want to know whether your department will provide the masks to the pregnant ladies. And then for babies' masks, I can never get hold of them. But then they need to go to clinics for vaccination. So how can you make sure that babies are getting the surgical masks as well? Now, I understand that the government is having a subsidy scheme for local mask production. Many people have said that raw materials would be the issue. As you can understand, the filter is getting more and more expensive. Instead of $30,000 for a ton, it will cost you $400,000 to $500,000. So everyone is trying to fight for the filter in the mask. You may very well set up a factory, but then you will meet a bottleneck if you have to fight for the filter. So I wondered if the government is going to subsidize the production of such components or materials so that we become self-sufficient. In this way, we can successfully produce masks locally. So I think the government should attend to the issues, that is raw materials for local mass production, masks for adults, pregnant ladies and young children. Otherwise, we cannot fight the battle on a long-term basis. Professor Chen, thank you. We all along are concerned about the issue of masks. I think in a moment, the government logistics department can brief you about the procurement. We have been sourcing the masks globally, and we have also turned to local production. Elizabeth Quart, Dr. Quart, talked about the availability of children's masks. We do understand that there is a shortage of supply in the market. We'll be watching the development and will continue to procure the masks. As to the raw materials needed, I think we can defer to the CDB representative. When we subsidize local mask production, I'm sure we have already considered the supply of raw materials. But then the outbreak has spread to many places. We don't just have an outbreak here locally in Hong Kong, but then other places are affected. So we need to act swiftly, as we can tell that there is a global demand for the raw materials. So, Mr. Lin, well, under the Anti-Epidemic Fund, please switch on his mic. Yes, please. Well, under the Anti-Epidemic Fund, we have the local mass production subsidy scheme. Well, please speak into the microphone. Under the Anti-Epidemic Fund, we have got the local mass production subsidy scheme, so that local companies can set up production lines in Hong Kong. Starting from the 2nd of March, we have been receiving applications. Well, in fact, the Hong Kong Productivity Council has been talking to businessmen who are interested in local production since late January, by providing technical assistance to them. Understand that some factories are able to get raw materials to produce the masks locally. But of course, in addition to raw materials, for you to manufacture the masks, you need the factories, you need the equipment and machines. The Hong Kong Productivity Council has been providing technical advice to parties interested. Well, what about children's masks? Has the government procured them? How many? And can you assure us that there will be sufficient children's masks for them to resume class? Well, I think for Dr. Quart's concern, of course, she has a number of concerns. One being that you can't allow children to wear masks that don't fit their face if you would like to resume class. GLD. Thank you, Chair. For the GLD, we have adopted a multi-pronged approach. We have been procuring globally PPEs directly, including the masks, and we have got ETOs in different cities. Can you not give a direct answer to children's masks? Did your procurement exercise cover that? Well, for surgical masks, we have got two different sizes, one being the normal size, the other being a smaller sized one. Is it for children? For a smaller face, but still for adults? For an adult with a smaller face or a older children will do. Well, they may be for ladies, but what about young children? What about infants? Have you got any of them? What about junior primary school children? Do you expect them to use this kind of mask. I think the point is noted. So maybe the Education Bureau, Ms. Chen, should note this point. You should liaise with the Government Logistics Department. Classes will resume next month. We can allow children to have loose-fitting masks.
Ray Chen. Well, the outbreak of the novel coronavirus has we have had the outbreak for 3 months already, and the epidemic is still in a very serious state. Hong Kong is fortunate in that we do not have a drastic increase in the last few days. But I don't think the officials would dare say that the epidemic is now under control, like what Matthew Cheung said. That is, there won't be a further exponential growth in the number of cases. But this morning, when the CE met with the media this morning, given that we now have 115 confirmed cases in Hong Kong, compared with the rest of the world, we do have a relatively small number, and the government seems to be rather complacent about this, and he's trying to, show off by saying that Hong Kong has done a much better job than elsewhere. I hope that our officials will not have this kind of attitude. I think initially we criticized the government for being too slow in taking action, be it the supply of surgical masks and medical equipment and the closure of the border control points. It would appear that you will only take action when we put pressure on you. For example, we asked that all, visitors coming, to Hong Kong by plane would need to make a health declaration, but you only did that on the 8th of March. You could have done that earlier. It would be much better if you adopted such a measure. Why is it that you took so long before you decide to do that? And Hong Kong has done better than many parts of the world, mainly because many people in Hong Kong are vigilant. They started to wear masks at a very early stage, although some people say that it wasn't necessary. And we also have strikes by medical, staff to put pressure on the government so that it will partially close off the borders. So your question is, of course I have a question, it's coming. I have 5 minutes, Madam Chair. I'm just worried that the officials don't have enough time to answer your question. I think Taiwan has done a much better job. Taiwan has 45 confirmed cases. They have now come up with a primer which will only take 15 minutes to show the results. I'd like to ask the government whether they were liaised with the Taiwan authorities so that we can use those primer to help Hong Kong identify the patients, more quickly. In Taiwan, has adopted a very, skeptical attitude towards, statements by the WHO. So if you're talking about fake news, you have a lot more fake news regarding the coronavirus. If you go to the websites which have been put up by those who belong to the pro-government camp. If you look at the figures for Guangdong, recently we've been told that there have been 0 new cases. I'm really skeptical about that. I'd like to ask the Secretary whether you have any doubts about these numbers. I've asked some people, and they say that they don't have enough primers, and because they've all been sent to Wuhan. So it doesn't necessarily mean that the numbers are correct. So there has been rumors the government is planning to relax restrictions on visitors from other parts of mainland coming to Hong Kong. So I'd like to ask the Secretary whether you really totally believe in those figures from the mainland. And secondly, regarding compulsory home quarantine, we now have more than 20,000 people subject to quarantine, but the quarantine is not really effective at all. Initially, you have police officers, visiting the homes of these people or call them up, but subsequently, this wasn't done anymore. And also, people who violate the quarantine requirements, there have been very few, prosecutions. Secretary, 3 questions. Primers and are you planning to relax the restriction for visitors from other provinces in the mainland coming to Hong Kong? No, I'm talking about Guangdong, for example, where we're told that there have been zero infection recently. Thank you, Mr. Chair, for your question. Right from the beginning, where we have the outbreak of the epidemic, we have been staying vigilant. Other than paying attention to the figures, the numbers issued by the mainland, we also pay attention to numbers released by other countries. Regarding liaising with the many authorities and the figures that they release, we have been closely liaising with the state, Central Committee for Health. So other than the WHO reports, our own experts and our own committees, we have two experts which actually attended the WHO meeting, with the WHO representative and the mainland officials, and they've been able to report back to us after that meeting. So we have always been staying vigilant. Regarding the mainland, of course, the number of new cases have now dropped to a very low level, and in some provinces there have been zero new cases. They've also just started to people are started to come back, going back to work, and they also are beginning to have some imported cases in the mainland. So we're still closely monitoring the global situation. Is it that for the time being you have no plans to relax the restrictions on visitors from the mainland? I think members will remember that for those residents from Wuhan and Hubei, if they come to Hong Kong, they're not allowed to come to Hong Kong at the moment. And for mainland visitors, for people coming to Hong Kong who have been to other provinces in the mainland in the last 14 days, they will be subject to compulsory quarantine. And this measure is still in force. As for primers, I think locally we have universities which have developed such primers. The latest information, we've also forwarded the latest information to the HA, and they're now looking at it. We believe that our labs, for the measures that we have now adopted to test the COVID-19 virus, we believe that the measure is still very, very reliable. Regarding compulsory home quarantine, it is actually the police and the disciplinary forces which are doing that. Right from since the beginning of the outbreak, we have more than 5,000 such visits to those subject to the home quarantine. Of course, we still need to rely on self-discipline by those who are subject to quarantine. Officers from our various departments will call them up randomly, and and we also have prosecuted. We have prosecuted at least 2 persons and 7 persons. We've already collected evidence and considering to prosecute 7 others. So we're also collecting evidence in respect of other persons as well. In some other countries, they have reagents which will show the results within 15 minutes. I think in our laboratories, perhaps I can ask the Center for Health Protection and the HA to further elaborate on this. Our public hygiene labs and the labs of the HA, perhaps I'll ask Dr. Wong to elaborate. Dr. Wong. Indeed, the testing is very important. The Center for Health Protection attaches a lot of importance to this, and at an earlier stage, we already, have actually adopted, some the reagents to test that. And we have some tertiary institutions which are now developing reagents which can help test the presence of the virus. So on our part, we will, conduct evaluation, and if these reagents work, we will adopt them. The important thing is to pay attention to the sensitivity of such tests and the accuracy of such tests. So we need to be very careful and we need to make careful evaluation to see whether or not there are any new reagents that we can use. At the moment, how long would it take to have results? At the moment, the reagents that we use will show results within a few hours. Now, Secretary, if you're going to make the relaxation, I hope you will do it step by step. But I've heard from people who operate factories in the mainland, they are now very angry because they need to visit the facilities in the mainland. So please, consider giving them priority. Eunice, Ms. Chen Hoi-Yan. The first confirmed case was found in January 22nd. We now have 112 cases already. Compared with other countries, since we've made a lot of efforts that we're able to contain the number of such outbreaks, but it doesn't mean that the risk is any smaller. We're different from other countries and cities because we have this experience of SARS, and the people of Hong Kong are very vigilant, and many people are now wearing surgical masks. In other cities, many of the people still don't wear masks. So if we have been lax, then I think we could have ended, like Korea and Italy. So far, 105 countries and cities already have confirmed cases and massive outbreaks. So regarding imported cases and prevention of outbreak, I would like to follow up on these 2 points. Regarding imported cases, I understand that the government is now adopting import control against people from various countries. I'm not talking about outbound travel alert. I'm talking about, visitors from other countries. I understand that you have very strict, control against visitors from Korea. They will not be people from Korea will not be allowed to enter Hong Kong. The situation in Italy is getting out of control. In Iran, there are more than 6,000 confirmed cases. You're saying that these are large countries and you have outbreaks only in certain cities. But now that you have a global outbreak, you should adopt drastic measures. Even if you do not impose a total ban on visitors from these countries, could you require people coming from these countries to provide medical proof? If they do, then they will be allowed to come into Hong Kong, otherwise they will not. That would be the effective way to prevent further imported cases in Hong Kong. And I'm not counting Hong Kong people traveling abroad. Secondly, on local prevention, I'm particularly concerned about children. In 2003, when we had the SARS epidemic, it started from the 29th of March until the 26th of April. Classes were suspended, and only in May that you have full resumption of classes. So this year, we've actually broken all the record. Classes have been suspended for more than 50 days, 51 days. And I'm very unhappy with the response from the Education Bureau. In your paper, you say that at the earliest, classes will resume on the 20th of April. So what is the stock of the surgical masks for children do you have? You talk about, surgical masks for adults and also a smaller version, but for masks for young children, it should be less than 10 cm. This is for the use of kindergarten children. This is, for those from age 7 to 15 years old. So there are two different sizes of surgical masks for children. The Education Bureau said that they are now looking for a small surgical mask of a smaller size. I think for kindergarten children and junior primary students, the masks are a lot smaller, and it's very difficult to find them in the market. So my question for the Education Bureau is, how many of these masks for children do you have? Other than students and medical staff, could you update us on the latest numbers? Recently, you told them that you only have stock which will last for a month. So you say you're making global procurement. That doesn't really work. I mean, could you tell us what is the stock that you have at the moment? You also wanted the private GPs to help conduct more tests, and you emphasized that these tests will be free of charge. Don't just talk about the testing. Private practitioners also have to incur expenses. You're saying that it's just that the testing will be free of charge, but the private doctors would like to help, of course, but they also have to incur expenses.
We have always taken a very vigilant approach. Currently, over 100 countries have got new cases of infection. And recently, we have got imported cases, though the number is not large, but we're still anxious about that. So as far as immigration control is concerned, we do have measures both for outbound as well as incoming travelers. We have a daily assessment. We know that for Italy, other than the few regions that got an outbreak in the beginning, other places within the country are also being affected, and the local government is also acting on that. So in relation to other places in Italy and other countries which see an increase in the number of infected cases, we are going to implement measures in relation to incoming travelers. Now, if we think that the risk in relation to a particular country is higher, then it isn't just a matter of whether we can demand a health certificate from the incoming traveler. We did get health advice from our experts. Now, what about the validity of a health certificate? As you know, that for the incubation period, it is long, and we have also got asymptomatic patients. So even though a traveler can present a health certificate, it is only good at that particular moment, and it doesn't mean that he or she doesn't have a risk of spreading the disease after a while. So it's better for a 14-day quarantine order to be imposed, and that's exactly what we are doing. As to the issue of masks, I would defer to the Education Bureau and the Government Logistics Department. Your third question was about extending the enhanced surveillance scheme to private doctors, clinics, and hospitals. We've invited them to participate in the scheme. Let me clarify. When we talk about free of charge, it means the test carried out by the laboratory, but then patients have to go to clinics for doctors to carry out an assessment. So the assessment, the consultation, the treatment, etc., of course, would be subject to a charge by the private clinic, and that is understandable. Education Bureau do know whether schools are actually ordering masks for their children, in particular the younger children. Ms. Chen from the Education Bureau. Thank you, Chair. We have been liaising with the educational sector. We'd like to find out about their stock. For some schools, they generally keep a stock because we have a seasonal flu every year. And then for primary schools, many of them do keep a stock, but then it would vary from one school to another. We'll try to find out the information from the schools first. Now we're talking about class resumption no earlier than the 20th of April. Well, other than the stock, Ms. Chen would like to know whether you have got masks for younger children as well as children going to primary and secondary schools. Well, schools will take into account the age profile of the students. Usually they keep masks for younger children and older children. So they do have, but we have to find out from the schools as to the number of masks they have. And then class resumption would not take place earlier than the 20th of April and by phases. A factor for consideration would be based on the supply of masks in the market. That would be a very important factor for our decision. We'll also get advice from the experts to see whether that would be the right time to resume class and in what way. School authorities are aware of this and they're making preparations for class resumption. And they try to source the masks from different channels. Some of them are approaching suppliers in different countries and not confining their sourcing to Asian countries. Understand that some of them are able to get a supply. And I emphasize that we're talking about masks for children. What about PPEs for the healthcare workers? Healthcare workers. So hospital authority, please. Dr. Chung or Dr. Chuang? Dr. Chung. Yes, if I may. About the inventory of PPEs at the hospital authority. We emphasize transparency both for our staff members and the public. We do update you at our daily briefing. Starting from the 15th of February, we have been giving daily inventory levels. On the 6th of March, we have got 24 million surgical masks, 2.6 million protective gowns, and then face shields 1.1 million. So we are good for a month to two. Recently, we have taken deliveries again. What worries us most is N95 masks, a stock level of 1.1 million. There are different models and different sizes. The total number is 1.1 million, but then it can only last for 4 weeks. So the supply is tight, and we are trying hard to see if we can cope with it and whether we can get more supplies. We can get more supplies. Mr. Poon Siu Ping, no, you give us 5 minutes each, but the chair lady has been asking follow-up questions on our behalf for another 5 minutes. Well, in fact, I do so for each and every member, so altogether 10 minutes each. Well, on the mainland and locally, we've seen an outbreak, but the outbreak has spread to other countries as well. We have got red OTAs on a number of countries. What worries us is that for travelers from such countries, what are we going to do with them? A few days ago, Professor Yun of the Hong Kong U told us that he thought the outbreak would not end. He said that probably we have got 800 cryptic patients in the community. Should they be sort of confined to their homes under a 14-day quarantine order? Now my question is, if you only wait for an outbreak to be established before you quarantine the travelers for 14 days, what actually is the yardstick? The number of confirmed cases or what? And then what is the government's assessment? If you get a large number of confinees that have to be quarantined, what about the capacity of our quarantine centers? Please tell us about the details. And then the $30 billion anti-epidemic fund, $4.7 billion will go to the hospital authority, and then $2.5 billion will go to the hospital authority frontline staff, like the special emergency response allowance, and $350 million on special rental allowance. We have full support for such measures. This is because they are all very committed and dedicated to their duties. Now, what about the recruitment of temporary staff and also staff from agencies? you're also handing out a special allowance and a special rental allowance, a special emergency response allowance to your own staff. What about the temporary staff and the staff engaged through agencies? $250 million will provide more support to the testing laboratories, like the acquisition of equipment and reagents. Well, Taiwan saying that they've come up with a new reagent that can give you a result in 15 minutes. Guilin said that they can get a result in 10 minutes. And then for Hong Kong UST, you get a result in 40 minutes. Now, the government said that our test will take a few hours, and you think that it is fine. What about the tests being carried out in other places, since they can give you the result very quickly? So are we going to employ such faster testing approaches? And then you talked about expanding the enhanced surveillance program, enlisting the help of the private clinics and the GPs. It seems that the response rate is poor. So are you going to find ways to enhance the response rate? Quite a large number of questions. I'll try to answer the questions one by one, and then the hospital authority as well as the CHP can also supplement. First of all, Mr. Poon asked a question about the exponential rise in the number of cases in other places. The CHP on a daily basis carries out a very detailed risk assessment. We'll take into account the following: the number of new cases every day, the rate of increase, the measures taken up by the health authorities, their control measures, the monitoring measures, as well as the capability of the laboratories. And then we'll just see if they are popular destinations for our outbound travelers. So we have been covering such areas in our daily assessment, and we do introduce timely measures, and we adjust our travel restrictions and report health measures. For our quarantine centers, currently, travelers from Korea, Italy, and Iran will be quarantined for 14 days. So for quarantine centers, as of now, still have got a spare capacity. But in addition to travelers from such countries, probably you notice that we have returnees from Hubei province. Upon their return to Hong Kong, they have to go to the quarantine centers. And earlier on, returnees from the Diamond Princess cruise ship. And then for close contacts of confirmed cases, again, they have to stay at the quarantine centers. So while we still have available places at the existing quarantine centers, we have carried out works to expand the facilities. Like at the Lei Moon Holiday Camp, you know that we have added to the total number of quarantine places. And then at the JPC Center in Bat Hang, we are going to get additional places. And then for government land at Pennis Bay, again, you know that we are trying to provide additional places. So we are working at full steam. For the hospital authority, in relation to their agency workers and their subsidies under the anti-epidemic fund, I would like to ask the hospital authority to supplement. And later on, I would like to invite the CHP to tell us more about the participation of private doctors in the enhanced laboratory surveillance program as to what can be done to fine-tune it. Hospital Authority, Dr. Chung, please. Thank you, Chair. First of all, we are grateful to the government because almost 15%, that is $4.7 billion from the fund, have been channeled to the Hospital Authority. Well, we are going to spend most of the money for the frontline officers for the acquisition of PPEs. And if they need to stay at a hotel, then they can make use of the special rental allowance, laboratory support, medicine, and enhancing their cleansing and disinfection work. I may not have the breakdown figures, but on the 24th, we made an announcement about the special emergency response allowance so that officers working in high-risk areas will get 25% in addition to their basic salary with a minimum amount of $500. So they are getting $500 as the minimum. And then for the winter surge, it has been over. And then for overtime allowance, we have also got a contingency for overtime allowance. In other words, we are going to get 20% to top up the overtime pay.
Also, private practitioners are helping us. For example, for locum doctors, up to the 5th of March, we have 199 private practitioners who have indicated they would like to help us at the HA. Our HR department has already processed 174 such cases. There are 60-odd doctors who have been assigned duties in different specialties. We would like to thank the people in the community which are helping us. When will we be able to have the list of doctors who have participated in this scheme? We are already processing the arrangement already because we need to do the matching. For example, we need to find out which departments have greater need for extra help and so on. Center for Health Protection. Thank you, Dr. Pun, for your question. The Center for Health Protection agrees that more testing and more surveillance are important, including testing by private clinics, so that we will be able to diagnose patients at an early stage, so that we'll be able to detect these patients at an early stage, so that proper treatment could be provided and public hygiene could be safeguarded. This is a new. We can also find out about how widespread the epidemic is. Recently, we've written to all doctors in Hong Kong. The Department of Health will provide testing free of charge. And it's only the tests by our labs that we're talking about. The Department of Health, now whenever there is any disease with public health implications, the government will provide tests free of charge. For example, the Zika, virus and the AIDS, disease. So private doctors can actually, make use of the free testing provided by the Department of Health. In private laboratories, they have their own work to do, and they can certainly decide on how much charge they will impose for that. We understand that. We notice that we have many doctors who are willing to help. They have, indicated that they would like to participate and help, but there are also private doctors who have expressed a concern. We understand that private practitioners and labs, I think their support is very important. It was only yesterday that private practitioners can send their samples to our labs for testing. So we will closely monitor the situation, and if further arrangements or assistance are necessary, we will do our best to do that. Mr. Lee Kwok Lun, thank you. Chairman, Madam Chair, I have two questions. First of all, regarding the hospital beds. In para 15, we understand that as of the 8th of March, there are 900 odd such cases. The HA intends to convert those, wards. There are 400 to 500 negative pressure beds. The government told us that there were 1,400 such beds. They should be able to cope with the epidemic. Touch wood, so far we do not have too many confirmed cases which require isolation. But when you say I'm puzzled by what you say in your paper. Of the 1,400 cases, you have 900 odd which are already being used, and you say that's 30%. If I work at the front line in the hospital, I would like to know how many isolation beds could be used. In each ward, how many such beds could be used? In my ward, for example, could it be suddenly changed from a medicine ward into an isolation ward? Let's say you have all the facilities in place, you have put in place the negative pressure beds. So what's going to happen to those beds? Originally you told us there are 1,400 beds. You're able to cope. Where are those beds now? Why do you need to make the changes now? Regarding the number of beds, or do you have enough people to to provide the manpower? Will these facilities work? Will these be negative pressure beds? If it's NPS and not MPA, will it work? The frontline, colleagues are all very puzzled. And also, are you going to ask us to join the dirty team? Do we need to join the work for the dirty team for 6 to 8 weeks? I have no doubt that our frontline staff are all very, conscientious, but you have such confusion regarding the number of hospital beds. So what are we going to do? Everyone is confused. And also, if I were to take up such duties, I would need training. Not to mention the PPEs. The important thing is that the beds would need to work. Like Ray Chen said, the CE seems to be very complacent. He's saying that we're doing a good job. But it's because the frontline staff has done a excellent job that we don't have a major outbreak. But what are we going to do regarding these hospital beds? And secondly, regarding the PPEs, I'm talking about standards for, infection control. I understand that underneath the secretary, under the secretary, we have, expert panel comprising experts from the Hong Kong University. Now, so I'd like to know whether or not you have any expert panel to tell us about what is the standard for infection control for the hospitals. The HA, according to past record, I think since the 21st of January to the 5th of March, the whole infection control standards have been changed 8 times. At one time, we're told that we could use surgical masks. Sometimes you say we need to use N95, and then, tier 1 PPE or tier 3 PPE. Sometimes you say the PPE could be reused, otherwise you say it cannot. So how are the frontline staff going to follow? Whether you call it the Wuhan, virus or the COVID, coronavirus, I think the most important medium for transmission would be droplets. So the transmission medium in a hospital, why is it that you've changed the infection control manual 8 times? Not to mention the photos being circulated, together with the fake news. If I were at the front line, what am I going to do? And the infection control standard, I think you have different, criteria. But the frontline staff is saying that if you change the guidelines like that, is it because you don't have enough capacity? You are changing the standard. That would be very dangerous. We want to contain the outbreak. So how are we going to protect ourselves and the patients? So I've spent almost 5 minutes. So my question in summary is that what are you going to do about the hospital beds, and why is it that what can we do? How we can follow the guidelines for infection control if you've changed them so many times? Thank you, Dr. Lee. I'll first give a global response and I'll ask the HA to supplement. First of all, regarding the number of beds in hospitals, I think the HA still have these isolation beds, but as the epidemic develops and when we know about the clinical status of the patients in hospitals, I think the patients may need a longer time to recuperate. Even if the symptoms and clinical conditions have improved, but the HA is very stringent. It has to ensure that these patients are tested negative in respect of the coronavirus before the patients will be discharged. Of course, one would need to look at their clinical conditions. In planning for the provision of hospital beds, in paragraph 15, we have also said that we have some standard negative pressure wards which will be for patients whose tests have not yet returned negative. So we're going to provide 400, 500 additional standard negative pressure beds for patients who have recovered but have not yet been confirmed negative for the virus. Perhaps I can now ask the HA to further elaborate on this point and talk about the standard for infection control and also regarding the PPEs. I think for any infectious disease, these are very important. So whether it's the HA or the Department of Health, we think that we need to have standards, and we will also need to make reference of the guidelines issued by the WHO. Dr. Zhong. Thank you, Mr. Lee, for your question. Honestly, whether it's the change in the number of hospital beds and how we deploy these hospital beds and the PPEs, I think the epidemic is changing rapidly. I think frontline medical staff, I think are working very hard because they need to adapt to the changing situation. I'm really grateful to them for the efforts because they have tried their very best to accommodate to the ever-changing situation. We have 1,400 hospital beds. Since SARS, we have been gradually increasing the number of such beds. We now have 1,400. We have 480 odd negative pressure hospital beds. We have been gradually increased that to 854. Of the 1,400, we are able to use 1,200. There are 100 odd such beds which can no longer be used because Guanghua Hospital is subject to redevelopment, and also we have another several dozens at the TMH which could not be used. We have now about rough 1,200 odd beds. The usage rate has now slightly improved, but we all know that the epidemic could spread drastically. I think the data now is similar to those we collected in SARS. Every time we receive a new patient, we need 4 extra beds to deal with the suspected cases. Simple arithmetic will show that if we accept several dozen such suspected cases, if only 10% were confirmed, we will soon be running short of these hospital beds. And that's why we are thinking hard as to how we can increase our capacity. On the 31st of January, when we adopted the enhanced surveillance measure, we immediately set up surveillance wards so that when patients, we will take half a day to carry out tests for these patients to see whether or not they're confirmed cases. So we'll use such beds. Basically, we are focusing on infection by droplets. We need to, conduct, various tests. I think Mr. Lee knows very well. It's the same, colleagues who typically normally would work in general wards. Dr. Zhang, perhaps after the meeting you can further liaise with Dr. Lee over the phone. It is not even talk about the standards yet. Fernando Zhang. Well, Madam Chair, I think the Wuhan coronavirus, I think it's 30% is due to natural causes and 7% human error. I think initially they did not try to resolve the problem. They tried to actually, go against the person who raised the problem. Hong Kong refused to close off our borders. We have been very slow in our responses each and every time. And now Professor Ying Kwok Yung have already said that closing the borders, with the mainland is no longer meaningful because we are beginning to have, imported cases from other countries. Recently, we have imported cases from India, and the number seems to be increasing. And we don't seem to have adopted measures to tackle that. You now have health declaration requirements. While we have some measures, but the government has been very slow in response to the situation. So how are we going to, control the human traffic? I haven't seen the government done anything yet. The government has been very slow in the procurement of surgical masks. At the beginning of the outbreak, you still resorted to tender. Only later did you go for direct procurement. So I'd like to ask the Logistics Department and the HA as to when you will start making direct procurement. Could you give me a date? And also, we are also short on staff. I'd like to salute all our medical staff. I understand that in the isolation camps, I understand that the DH has actually requisitioned some, people from the HA to work at the, quarantine camps and to carry out tests. Would that be an appropriate, move? Because the HA itself is already, short of staff, and you're extending the testing to involve the private doctors. I think that's a good thing because 40% of the confirmed cases, the patients have first consulted the private doctors. Dr. Yang Chiu-Fat of the Western Doctors Union said that he didn't know how to participate in this scheme, and he said that he don't know. He doesn't have a list of the verified labs, and they don't know how to take the samples to the Center for Health Protection, and they asked whether or not there should be a central collection facility. So can you extend this testing scheme to all private doctors and private hospitals?
Recently, we've noticed that in places including India, the infection is making us more and more worried. And what about primary schools? Can we not provide the supplies to the school authorities? Otherwise, the entire city will be threatened. For the PPEs, I don't think it should be confined to the healthcare workers. We need the PPEs for many different scenarios, like when we can resume the classes and when we can resume the visits of patients. So I hope the hospital authority will act more positively when it comes to procurement. Thank you, Dr. Cheung, for your questions. As to the risk of imported cases and the global outbreak, we are having a daily risk assessment. As I have said, we don't just look at the number of new cases and whether there is an outbreak. We'll also take into account the prevention and control measures by the local authority. We'll check if we are already getting imported cases from a particular source. Dr. Cheung talked about India. We do get some cases imported from India. My understanding is that we've got 5 confirmed cases. We need to keep a close view on that. The total number of confirmed cases there is not on the high side, but then some members said that maybe it had to do with the overall testing ability as well as the prevention and control measures adopted locally. So we know that everything is very fluid, and we don't rule out the possibility of introducing measures including travel restrictions in relation to incoming travelers. And then for procurement, in a moment, the hospital authority and the government logistics department can give an answer. For the hospital authority, some of the staff members go to Chunyang Estate so as to help the Department of Health as well as the Hong Kong U to collect samples to test for the COVID-19. I think it is purely on a voluntary basis. On the one hand, we would like to cover all the 469 returnees as soon as possible. We would like to test each and every of them. We are concerned as to whether some of them have got certain conditions or whether some of them are confirmed cases. So we need to get more colleagues working at the same time. All of them do so on a voluntary basis, but of course the hospital authority can supplement. And then Dr. Wong from the CHP can tell us more about the scheme covering the private doctors. The scheme has been enhanced and extended to the private sector. We have written to the private doctors, clinics and hospitals. That is, they are able to collect the samples for the test for COVID-19. It was only launched recently. And in relation to the details, I think the CHP will continue to liaise with the private doctors and explain the details to them. For the ethnic minorities, I think the director can also tell us as to what sort of public education has been provided to them. Who would like to take up the questions? Maybe Director of Health on ethnic minorities and the hospital authority and then the GLD. Dr. Chen, for the ethnic minorities, we do take it seriously when it comes to public education. Information about infectious diseases, including COVID-19, well, on our thematic website, we do provide the information in different languages. And then in the month of January, around about the 20th or so, we liaise with consular staff in Hong Kong so that we can pass the message to the domestic helpers here, the foreign domestic helpers. Well, I don't think you should expect information available on the website and then the message can reach the ethnic minorities. I would think that you better take up the matter with the organizations that are in contact with the ethnic minority communities. Of course, they can visit your website, but then they need the supplies and they need the information in hard copies. Yes, indeed, we need to be more caring towards the ethnic minorities. As to the other questions, I think we can go back to the questions when there is time left. Mr. Shiu Ka-chun. Well, here we have the leaders leading the battle against the disease. I'm concerned about your own health conditions, because if you can't cope with it, then it will be bad. For the CE, Professor Chen, Dr. Constance Chen, Dr. Wong Ka-hing, Dr. Chang Chuk-kwan, Dr. Chung, I want to know whether you undergo a daily health check to make sure that you are given extra protection so that you are tested daily to find out about your health status. And then Another question is about surgical masks. Yesterday, the SWD said that 1 million surgical masks have been given to the aged homes or homes for the aged as well as the homes for the disabled. While we were attending the meeting, we were told that yes, they did get a large number of surgical masks, but many of them weren't the three-layered surgical masks. I want to know about the source of such masks and what about the specifications? Are they in line with the CSI's specifications or are they of a poor quality? It is said that you have collected many masks for onward distribution to the end users. Do you have a specific set of standards in relation to the masks that you hand out? On the 23rd of January, it was said that the FHD would give the surgical masks to the cleansing service contractors, those cleaning up the streets, RCPs, toilets, public markets, etc. Only such will be covered, and 1 mask per day. For foremen, drivers, pest control outsourcing contractors, drivers for the LCSD, pest control workers, etc. are not covered. And it was said that the service contractors would not allow the workers to use their own masks, nor ones donated by the community. So what is the latest position? Has the FHD imposed a requirement on their contractors to provide a mask to their own workers per day? And are you banning the use of their own personal masks? SWD, so substandard masks, where do they come from? SWD, Mr. Chen, please. Thank you. Thank you for your questions. Well, in the past, we have been delivering 1 million surgical masks to the homes for the aged and homes for the disabled. My understanding is that they have come from the government logistics department, so supplied by the GLD, correct? It isn't that we have collected them from the community, but then the organizations may get masks donated from other source by other sources, so there may be a case of misunderstanding on the part of their workers. So the government is assuring us that they come from the GLD and they are the same as the CSIs. So you're not going to provide anything that is below the specifications or standards of the CSI, right? And they are 3 layers, right? GLD. Last month, we've issued a mask to the SWD for onward distribution to the welfare organizations. They are all CSI masks. If you find that they are not, then you better sort of produce them and show them. What about the FHD's masks for the outsourced services? Of course, we know that for the service contractors, they did encounter difficulties in procuring the masks. In order to safeguard the health of our frontline workers and not just our own FHD workers, we would like to cover the workers under the outsourced cleansing contractors. The CE already said that additional masks produced by the CSI would be given to the contractors. So we do have arrangements so that those workers cleaning our public markets, etc., will get a supply for their workers. Earlier on, the member referred to a broader issue. We hope that with the easing of the tight supply of masks, we hope that the contractors can procure their own masks. Do you allow workers to use their own masks? It was said that it wasn't allowed earlier on. What is the position now? We haven't got information about that. There is So you don't impose any restrictions. No. Chair, you need to understand, you only issue one per day. You don't allow them to have their own, and you don't allow them to use those donated by the community. But then you're exposing the cleansing workers to a high level of risk. So you just allow them to use their own and use the donated ones. How come that you don't allow that? Yes, I think we need to take up the matter with the FEHD. Well, we know that many people are donating or giving out the mask to the cleansing workers. Do you allow that? Will liaise with the contractors. Mr. Yu Si-wing, Chair. At first, we thought that the outbreak would be over in April. Both mainland experts and Hong Kong experts are saying that it will probably take us to June or even end of the year. Our economy will be dealt with a serious blow. We have the anti-epidemic fund of $30 billion. I think on the basis that the government thought that it would see us through the epidemic. But then if it is going to last until June, then we are worried, in particular for tourism-related sectors. They are in a great hardship.
If the epidemic lasts for a few more months, would it be that all the businesses in Hong Kong will close down? I hope the government will, after you've exhausted the $30 billion, will you review whether or not you will provide more support measures? How can we, I think we are an externally oriented economy. I don't know whether the government will come up with the next, round of relief measures. Recently, Thailand had sent out very confusing signals regarding entry requirements. We were told that there will be a quarantine for inbound tourists for 14 days, and then subsequently they denied it, and so on. So for Hong Kong residents who are traveling in tour groups or individually to Thailand, they don't know whether they should go or not. So for the last couple of days, I don't know whether the government has done anything in this regard. Is it that you have had no response from Thailand? And secondly, have you, found out how many people and tour groups have been affected? And when there is such a scenario, do you have a mechanism to deal with it? Because the tourist agencies and the people, the tour members cannot make inquiries. Only the government can do that. Also, inbound visitors will be subject to a 14-day quarantine. Some will stay in their own premises, some may stay in hotels. But very often when the tourists have reported the hotels that they're staying in at the port or the authority, I think the immigration department will have to inform the hotels, because the hotel will not know what are the reasons why these people are subject to quarantine and so on. If the hotel knew beforehand, they can allocate dedicated floors to accommodate these people who are subject to quarantines, so that the visitors will know that infection control measures are in place for those floors and so on. So will the government improve on that situation? Because at the moment you're not informing the hotels. Secretary, thank you, Mr. Yu Si-wing, for your question. Of course, our economy, I think, other than the budget, the FS has also launched several rounds of relief measures, and also the anti-epidemic fund has been, set up to cope with the economic downturn and to support the different sectors of the economy and even the general public at large. But as the epidemic, continues, I think other than the anti-epidemic efforts that we're now making, I believe that we will continue to monitor the state of our economy. Mr. Yu referred to the case of Thailand. I would like to defer to the Commerce and Economic Development Bureau to respond. Over the last few days, I believe our ETA in Thailand has been trying very hard to find out about the latest situation. My understanding is that we still don't have any clear signals. To follow on Mr. Yu's question regarding incoming visitors and whether we can, disseminate such information to the hotels, I'll ask the Department of Health to answer that question. Mr. CEDD, let me first of all answer Mr. Yu's question regarding the number of visitors who have been affected, and the Security Bureau can further supplement. As of yesterday, the information we received from the Tourist Agency Association is that we now have 10 tour groups in Thailand. Around 260 visitors are involved. The tourism agency told us that roughly about 52 groups have been cancelled. So that's the latest number. Security Bureau, would you like to add anything? Yes. I think the Secretary already said that in the last few days, the signals from Thailand has been rather confusing. On the 8th of March, the Hygiene Department made an announcement and the Tourism Board also made another announcement. The Civil Aviation Authorities also sent us some notice to the airline companies. So through our ETA office in Bangkok, we have the ETO office in Bangkok, we have been, liaising with the relevant authorities in Thailand, and also we have also tried to, find out through the Chinese embassy in Thailand. Because the state of the epidemic is developing very rapidly, and that's why we have some confusing signals coming out from Thailand. So we'll closely monitor the situation, and when we have any further information, we will let the public know. I think for residents who need to make travel abroad, they will need to also pay attention to the conditions in the country concerned. Dr. Chen Puyin, Pierre Chen. So he's not here, so Alice Mack. Two questions, Madam Chair. First of all, there have been one confirmed patient whose pet has been found positive to the coronavirus, and that has caused some public concern as to what is the impact of the virus on pets. For some confirmed patients and their close contacts, if they have pets at home, will these pets have to be subject to quarantine? But apparently, the AFCD said that pets are not a transmission medium. But other than that, we don't have too much information. Could the government now tell us how the owners of the pet should deal with such a situation? Should they take care of the hygiene and cleaning of the pets, and what are the things that they need to pay attention to? More importantly, you should let the public know that pets is not a medium of transmission. Otherwise, we will be worried that because of the public concern, people may abandon the pets. Secondly, there was earlier there was a question regarding the number of people who are still stranded in Hubei. We have already received more than 1,500 cases. There's still many Hong Kong residents stranded there, and they have needs for medical supplies and so on. We hope, of course, the government can arrange for these Hong Kong people to be repatriated to Hong Kong ASAP. And also, while they are in the mainland, they have different needs. I'd like to take this opportunity to thank our ETO in Wuhan, because there are only a few people in the ETO office there. Many of the people stranded there, many of them have urgent needs for medicine and other daily needs. Our colleagues in the ETO have been actively approaching these Hong Kong people who have such needs and provided them with speedy assistance. But other than that, I believe the Hong Kong people stranded there would like to come back as soon as possible. So what plans does the government have to repatriate them to Hong Kong as soon as possible? Thirdly, many people have already asked questions regarding the surgical mask for children. We are all concerned that after the classes are resumed, would there be enough masks for school children? Between now and April, when classes are resumed, we're told that we now are beginning to have local production of surgical masks. We heard, of course, that there is also a shortage of the raw materials. The Legislative Council is now assisting some factories which are going to start producing surgical masks. Now, when they start production, would you encourage them to arrange for production lines to produce masks for children? Could you encourage them to produce a mask for children as well? 3 questions. Now, before you respond, I'd like to ask a question regarding Alice Mack's question. Had there been any staff at the Wuhan ETO who have been infected? No, I don't think we have such information. Secretary, I'd like to thank Ms. Mack for the question. Your first question is about pets. We don't have evidence now to show that pets could be infected or become sick because of COVID-19 or cause infection onto humans. So for people who keep pets, I think first of all, they need to, first of all, maintain good personal hygiene, including also they need to wash hands frequently, take proper care of the pets, and try not to, be too close to the pets, and maintain good environmental hygiene. If they are feeling unwell, they should avoid, getting in contact with the pets. If they discover that there are changing, if the health condition for pets change, they should seek treatment from or advice from their vets. Of course, if the pets are sick, then the owner doesn't need to panic. The important thing is that they should consult the veterinary surgeon. But under any circumstances, they shouldn't abandon the pets. If the owners continue to take care of the pets, if they don't want to take care of the pets, they should get in touch with the AFCD or the relevant organizations. Regarding surgical masks for children, of course, they are necessary. I believe the CEDD is responsible for providing support for the support for the local production of surgical masks. So for business people who are producing these masks, I hope they will pay attention to the need to produce masks for children. And thirdly, for those Hong Kong people who are still stranded in Hubei, on the one hand, the ETO in Wuhan and our colleagues in Hong Kong are maintaining close contact with them, and we are steadily responding to the needs. As to when they will be repatriated to Hong Kong, we are working very hard on this already. Perhaps I will now invite the CMAB to respond. I think the SAR government is very concerned about all the Hong Kong residents who are now still in Hubei. We understand that they would like to return to Hong Kong as soon as possible. We need to consider the need for quarantine and the capacity of our medical system to cope with the epidemic. In Hubei is now subject to closure public transport has not yet returned to normal. So we need to make carefully plan for the for charter flights to take these residents back to Hong Kong. We are now continuing to work closely with the Hubei authorities, and based on we will try to repatriate these people back to Hong Kong as soon as possible according to their respective priorities. We hope to be able to have an announcement as soon as possible. We're grateful to Ms. Mack for her concern about our colleagues in the Wuhan ETO and can support the efforts to help Hong Kong people who are still in Hubei. And they will continue to provide the necessary assistance to people who are still stranded in Hubei. We still have 8 colleagues who haven't yet asked the first round of questions, and we have 3 members who are requesting for a second round. So for today, I will first of all try my best to allow the 8 colleagues to ask the question. According to my estimate, I think I will have to extend the meeting by 15 minutes, and I'm afraid we may not be able to enter in any questions for the second round.
Mr. Roy Kwong. Well, we are in a lot of difficulties, and yet Carrie Lam is still trumpeting her success. Is it that her government can take the credit? Shameless. In fact, every citizen is doing his or her own part. Carrie Lam's administration was doing a bad job. They didn't even don a mask, and they would not close the borders. And then you try to have designated clinics in the neighborhood and quarantine camps in the neighborhood, but not near to the government house. So we are having a lot of difficulties. But I'm sure if you have been doing evil deeds, you will meet your fate as well. Now, it seems that we are seeing some results, and then our government is saying that they can claim credit. It's not that the administration is behind all such efforts. Rather, the public are finding their own ways to get masks. I don't think Carrie Lam should be boasting. I think we're just watching what will happen to her one day. Now, Ho Kai Ming, if you would like to speak, you press the button. If you are committed to fight the epidemic. Now tell us, for usage, they don't have enough protective gowns, they don't have enough N95 respirators. I want to know for how long can they, what about the inventory of the PPEs? For how long can they last? It is said that certain PPEs have been withheld from the frontline workers. Frontline workers don't know where they can get sufficient supplies. Now, Secretary, tell us which cluster has the largest shortage, and then please tell us about the stock level and for how long the stock can last. Well, for the details, I think I can defer to the hospital authority. But first of all, I would like to ask Mr. Roy Kwong to understand that for PPEs and surgical masks, as far as the supply is concerned, in the light of the developments of the outbreak, and despite our earnest efforts to procure them, the supply is still tight. So for the administration, for the government, for our PPEs and surgical masks, healthcare workers will get the topmost priority when it comes to allocation, because they work at the front line and then they're fighting the battle for us. So we do take it seriously, and they play a very important role. Now you ask which cluster has got the most acute shortage and what sort of inventory level have we got? I'll defer to Dr. Chung. Dr. Chung. Yes, we're concerned about the PPEs. Among the 7 clusters, we have been holding meetings all the time and watching the inventory levels. The PPEs can last us for 1 month or 2 across the 7 clusters. But then sometimes in a particular cluster, the supply may be in the supplies are in shortage. It is because of the difficulty or the delay in refueling the stock from the storage. I think N95 respirators is the main issue. We are still fighting. We are still working hard. Sometimes a frontline worker may want to get a particular item of PPE and yet he doesn't get it. We would very much want to give it to the frontline workers. But then for N95 respirators, they are mainly for AGPs, aerosol generating procedures. If we aren't careful about the usage today, we won't have them available next week when there is a genuine need. So we are saying to our staff, sorry if there is no justification for the use of AGPs, please use the surgical mask. Dr. Chung, even Professor Yun told us that you know that you have an acute shortage and you're only good for a month or two. I think the PPEs have all been grabbed by the police. For Hong Mei House, it's a sort of spacious area, and then they are fully protected and they're taking selfies. Now we are fighting for the resources on behalf of you for your frontline workers. Even firemen are saying that they haven't got enough PPEs. Every time you are telling us that you have got inventory for a month or two, can you not be more specific? If you don't have enough supplies, please be honest and tell the community. Chairman, you say that we can steam the surgical mask. Please don't mention that again. Sorry about that. What about protective gowns? How many have you got? I think you said you have got 200,000, 2.4 million surgical masks. What about N95 respirators? Do they mainly come from the mainland? We have always been getting them from the USA. It would be very difficult nowadays. Well, for the mainland produced N95 masks, with the resumption of production, we're getting some from them. But then for the masks from the USA, it is very, very difficult. Yes, we have to be aware of the difficulty. So a question of delivery of orders. Professor Chen. Mr. Chen, of course, we mustn't take it lightly, but then unjustified accusations would not help. Throughout the outbreak, I think I share the sentiments of many citizens. Many officials have been very hardworking. For Dr. Chong Chuk Kwan, I went to Hong Mei House. She went to the sewer system. She took samples. She worked together with other colleagues till the small hours. Such images might not have been caught by the TV cameras, but in fact, like many other staff members, they've been working quietly, diligently. So please don't make unjustified accusations. It is unfair. For the mainland, for the COVID-19 outbreak, well, 1.4 billion people are willing to stay home so as to solve the problem. And as a result, for Wuhan, we have got 17 additional cases. For the country as a whole, we have only got an additional case in 2 provinces, respectively. Well, that takes me to a scenario. We were trying to be strict about the travelers from particular places, but not so for other places. Now, in the case of the USA, they are not going to have any universal testing. They would just regard it as a case of serious influenza. I think that's more worrying. My question is, what are you going to do? What measures and what standards are you going to adopt so as to deal with travelers from places where the outbreak has eased? Are you going to relax the travel restrictions? And then for other places where we are seeing an outbreak, are you going to be more tactical and introduce travel restrictions and quarantine orders? Now, we have a quarantine order lasting for 14 days. I think it is all because of the false positive or false negative results arising from the test. Maybe the test isn't that accurate, and therefore we need to observe such the patient or the context for such a long period of time. So for the test, I want to know if the administration can tell us more about the progress. Can you not be more reassuring? Because we're worried as to whether we can test more people so that you don't have to quarantine them for such a long period of time. In addition, for traditional Chinese medicine practitioners, it seems that they are not playing any role in the treatment of the patients. Are you going to enlist their help as well? Secretary, I think everybody is concerned about the tests for the virus. And then for the industrialists having factories on the mainland, they are anxious to know when they can go to the mainland to inspect their factories. In a moment, Dr. Wong can elaborate on the tests carried out and what they think about the latest developments. Mr. Chen is right to say that we need to monitor the spread of the disease in places outside the mainland. We have adopted measures like issuing a red OTA on 3 countries. We don't rule out the possibility that with ongoing risk assessment, we may be introducing other measures in relation to places where there's an outbreak. Currently, for Korea, Iran, and Italy, we have already imposed the requirement that anybody coming from such places will undergo a 14-day quarantine at our centers. With the outbreak cropping up in other places, we are going to continue with our monitoring, and we don't rule out having restrictions or other measures against other places in the time to come. Well, on the mainland, they have just resumed work, and they are getting imported cases. Now, the CEO this morning told us that she did not intend to change the arrangements for the time being, as we still have to take it seriously. Secretary, when will you start thinking about changing the quarantine arrangements? Mr. Chen. On a daily basis, we are reviewing the risk arising in different places. And mainly speaking, we will be having a risk-based approach. In due course, we'll make announcements about new measures. And then a word on the TCMs. All the time, we have colleagues liaising with the TCMs. As you know, that we have a Chinese Medicine Development Fund. We do encourage programs that help us to prevent and control COVID-19, and they can give us proposals under the fund. For prevention, TCM practitioners have come up with certain research suggestions, like we can have certain herbal tea or herbal soup. We'll continue to keep up with dialogue with them. So, Chair, with your permission, I would like to defer to Dr. Wong so that he can tell you more about the testing methods. Dr. Wong, yes, let me supplement. For our laboratory testing, we are mainly talking about the nucleic acid test. For others, they will also look at the antibodies. And then some universities have been researching into and developing alternative testing methods. For our public health laboratory service branch, we also review the new testing methods to see whether they are effective. For the public health laboratory service branch, we have also got our in-house R&D in relation to testing. And then for the NA test that we are employing, it is mainly an in-house development. But I don't think it is accurate. It is very accurate. Next, Mr. Ho Kai-ming. Thank you, Chair. Well, there are lawmakers who insist on calling COVID-19 as Wuhan pneumonia. I find it regrettable. I think you know what their intention or what their motive is like. They would like to smear China. You can do so here, but then if you go to the USA, Europe, etc., they don't care whether you are a Chinese, a Hong Konger, or an Asian. They will discriminate against you. Whether you are Vietnamese, Korean, Japanese, you will be discriminated against. So it is meaningless for you to smear your own motherland. For us to see people using this term, you should stop them. I don't think we should allow people to smear the motherland. Should we call Hong Kong SARS? No. It is a pandemic having an outbreak all over the world. You can't simply just attach the name or link the disease with the country where we got the first cases.
Secretary, some countries resort to relief as a solution to the problem. So the main objective is to, reduce the number of people who are infected. Now, I think in Europe the situation is so bad that in some case there was a clerk in a school who was infected, and the school decided that the children can still continue classes because the clerk was not in contact with the students. So they don't have this awareness. So if they resort to relief as a solution, and I think using the number of confirmed cases as a criteria is not very accurate. If some countries still relied on relief measures in respect of these serious cases, how do we deal with visitors from those countries? So how can we ensure that they are not carriers of the virus? We've adopted so many anti-infection, measures, but we don't. We don't want, people, bringing in the virus into Hong Kong. Even my wife is now, under quarantine. Secondly, regarding surgical masks for children, which Ms. Alice Mack asked a question earlier already. What I'd like to say that the machines cannot adjust for the size of the mask, especially fabric for masks to make, masks for children. The size of the fabric are different. So right now the fabrics are of a fixed size. For small children, the factories will have to order, fabric of a different size in order to make those surgical masks. Even though the FTU is not applying for any subsidy from government, but we would encourage more people in Hong Kong to try to produce more surgical masks. For the CDD and the Productivity Center, how are they going to encourage or ask or encourage people to make masks for small children? I have two, boxes of masks for children at home, and they are made in Japan. But now we're not able to buy any more such masks. So although it's not the business of the FTU because not getting any funding from the government, how can you encourage the factory owners to set the machine so that they can be used to make masks for children? So of the 20 production lines, could you, for example, make sure that the factory owners can allocate 1 or 2 production lines to make masks for children? 2 questions. Thank you, Mr. Ho, for your question. First of all, regarding monitoring of the overall state of the epidemic, the Department of Health and the Center of Health Protection are constantly carrying out risk assessment. What we consider would not only be the number of confirmed cases. We're also concerned about the relevant jurisdictions. How do they monitor what is the surveillance of the epidemic? You said it in some countries they are not resorting to containment. So as the number of cases change, and also we may need to extend the scope of surveillance given the state of the epidemic. We will try our best to shorten the chain of infection. So we are constantly doing this, and we will also be paying attention to all the announcements made by the WHO. And it has been suggested that this epidemic could become a global pandemic. We are closely monitoring the situation. As for masks for small children, I'd like to thank you for your suggestion, and that is amongst the production lines. We need to do something to ensure that we can have masks for small children. I'll ask the CED to further supplement. Regarding local production of surgical masks, other than the subsidy that we provide, the government will also guarantee that we will, be actually, placing orders for the masks produced for a year. Initially, when we subsidize these production lines, we are focusing on those, producers who can supply to the medical staff. What about small children? We cannot source them globally at the moment. I think you need to, plan beforehand. Well, I think there is a serious shortage of surgical masks for small children and adolescents. So I think other than masks for adults, I think you need to pay attention to ensure that they also make masks for children. Starry Lee, Chairman, I think this is a very serious battle that we're now fighting. The epidemic is highly infectious, and the carriers of the virus may not show any symptom initially, so we cannot detect them so easily. According to the news, the testing may show, different results. You could have false positive and false negative, results. So, in a nutshell, we cannot, be. So I think we need to be very, very vigilant. We need to continue to fight the battle seriously. It's exactly because this is such a difficult epidemic to cope with. I understand that some of the recovered patients already returned to work and gone back to the community. For these recovered patients, would the government continue to conduct surveillance on these people so that there will not be any relapse? We understand also that for those people returning from Hubei or those who return from the, Diamond Princess cruise, for these clusters of people, they are the major source of contamination. So for these people who have been discharged from hospital, will you continue to conduct medical surveillance on these people to ensure that there will not be any relapse? Secondly, regarding surgical masks, Professor Yun Kwok-Yung, who said that it's likely that this epidemic could become an endemic disease. So we need to be prepared. Now, initially, the public has criticized the government seriously about the shortage of surgical masks. During this period of time, and according to the paper, I'd like to ask the government whether you can provide us with more details. For example, when the government procures these surgical masks, how many masks have been ordered and how many have already been delivered to Hong Kong? And if this is going to be a protracted battle, does the government have a long-term plan? I understand that the epidemic has already spread to other countries. So there will be few places where you can source, surgical tasks because many countries will be imposing export controls. So you need to be ready when you're going to resume classes. You need to have the mask ready. Otherwise, the public will blame the government for not making, proper preparation. I'd like to know whether or not you can give us more details in writing. Secondly, regarding the price of surgical masks, while the supply is available, but they're still very expensive. A box of such masks may cost $100 to several hundred, and for many people in Hong Kong have asked whether or not the government should buy these masks at cost and then sell them at a subsidized price to the people of Hong Kong so that anyone with an ID card will be able to have access to these masks, because we're facing a protracted battle ahead. All right, price of surgical masks and supply. I thank Starry Lee for the question. First of all, regarding those patients who have recovered. Of course, when they are discharged from hospital, of course, the HA will continue to follow up on their conditions and provide them with, health advice. The Center of Infection, I think also for those people who have returned from the Diamond Princess, we also provide them with health advice. Of course, we would advise them to pay attention to the health, and if there's any problems, they should consult the doctor immediately. I'll ask the HA whether they have anything to add. Dr. Chung, regarding the recovered patients, we do monitor the situation carefully. For patients who are we have very strict guidelines governing discharge of these patients. Many people have asked questions about this, so we need to be absolutely sure before we will allow them to discharge. When these patients want to return to work upon discharge, even the employer may be worried. So we would advise them to actually, monitor the situation a bit longer before they resume the work. The RNA test now is very accurate. There are research being carried out which shows that even though the person still carries the RNA, they may not be able to infect others. As to whether or not the virus is still infectious, we're still conducting lots of research at the moment. So I don't think we need to worry too much. Regarding surgical masks, Mr. Lee is correct in saying that, Ms. Lee is right. If this is going to be a protracted battle, then regarding surgical masks and PPEs for medical staff and all the resources required to fight this epidemic, we need to make long-term preparations and arrangements. So I think the government, regarding the production of surgical masks, and other than global procurement, we also need to resort to local production. Although we may not have to produce enough sufficient quantities, but at least we can have local production so that the local residents and the medical staff will have could have such surgical masks that they can use. The CSD is now increasing the production. The CDD also has a scheme to support or subsidize local production so that there could be an increase in supply of these masks. Other than local production, of course, we would continue to source them globally. I think if this is going to be a protracted battle, you need to have a medium-term and long-term plan. You just can't tell us that local production and global sourcing will solve the problem. We have a shortage of masks and PPEs, and we cannot accept that even medical staff are telling us that they don't have enough of these resources. So the situation is serious globally. I think Ms. Lee's question is that other than the medical personnel, she's talking about ordinary citizens, and the fact that the masks are so expensive and they may not be able to afford them. Okay? Could you give us a detailed written response? Mr. Vincent Chen. I'd like to know about the condition of the Hong Kong residents who are stranded overseas. We have 2 cruises, for example, the Grand Princess cruise. Are there any Hong Kong residents on board which have requested for assistance? For the Diamond Princess cruise, I understand that there are still more than 20 people from Hong Kong who are staying in hospital in Japan. Recently, the DH has already sent doctors and other colleagues to provide them with support. I'd like to know whether or not there are still Hong Kong doctors supporting those, Hong Kong residents who are in serious condition in Japan. Thirdly, I understand that 2 Hong Kong residents have already passed away. Is the government providing any support for their families? First of all, I understand that the Grand Princess cruise does not have any Hong Kong residents on board. As for the Diamond Princess cruise, I would like to ask the Security Bureau to elaborate. I understand that the Department of Health and the Security Bureau, I think after the charter flights taking the Hong Kong resident from the Diamond Princess back to Hong Kong, we're still concerned about the state and the clinical conditions of those Hong Kong residents who have been repatriated to Hong Kong. And perhaps the Security Bureau can further elaborate.
Thank you, Madam Chairman. For Grand Princess, so far we haven't received any call for help from Hong Kong residents, but we still liaise with the cruise company. But so far we haven't received any request for help from Hong Kong residents. For Diamond Princess, 190 plus Hong Kong residents have been returned to Hong Kong by chartered flights. We have also got 23 officers from Hong Kong. They went to Japan, and then we have also got 3 medical teams with doctors, consultants, etc. to provide support to the residents staying in Japan. They will try to communicate with their doctors in charge, the patients, as well as their family members. The medical team has returned to Hong Kong for our support teams who have just changed the members. There are still 16 of them who are providing support to Hong Kong residents staying in the Japanese hospitals. And then 2 patients sadly passed away. One was a holder of a British passport. The family members said that they were getting help from the British embassy. So we will provide support to the other family in accordance with their preference. Yes, I understand that a few doctors have been very helpful. They attended joint conferences with Japanese doctors, and in this way they were able to allay the worries of the family members. But still, I'm concerned about a number of patients who are still having a serious condition. Your medical team has returned, so other than immigration officials, can you not provide further medical help to them? Yes, I know that family members are staying in Japan with the patients. I think they're encountering some difficulties. So FHB I think at least 3 patients are in serious conditions. Your expert team has returned to Hong Kong. So what about the follow-up work on the patients in a serious condition? SB. Yes, the Department of Health colleagues have returned to Hong Kong, but they're still keeping up a liaison with the Japanese authorities. We have people from the Immigration Department. We have also got Tokyo ETO staff members. Some of them are native Japanese, and they've been helping us in relation to communication between family members and the health of workers. So the doctors are still keeping up a dialogue, and as the Secretary has said, for Hong Kong patients with an underlying disease, we have also communicated with the Hong Kong doctors here. But of course, the treatment will be provided and has been provided by the Japanese hospitals. So far, the feedback of our doctors is that the patients have been given proper care. What about patients in a serious condition? Are you going to send doctors over to help them? For patients in a serious condition, as the SB colleague has said, we'll continue to understand the overall picture and the treatment received at the hospitals. If they need any help, we'll see what we can and should do. But then they're in Japan, and of course they will be taken care of by the Japanese doctors in their local hospitals. Thank you. Next, Mr. Wilson Ong. Yes. Sorry, speaker is off mic. Just now the chair has extended the meeting to 12:45. We've still got 3 on the list. Are you going to extend the meeting further so that all of us can have the chance to ask questions? If you don't object, we can. Because the chair, before she left the conference room, said that she will allow all members to have a first round of questions. So we'll do that. Mr. Oh, well, it is a natural disaster, but then we still have a caring world. I think we should stand united. It is important to have solidarity in this battle against the epidemic. At the local level, we have received encouragement and support. A few questions for the government. Surgical masks that the hospital authority has got. In January, we had an urgent question at the electrical meeting. The secretary told us that she would liaise with the industries and the relevant sector, and she would also increase the supply. What have we got here? We see the results. I won't say that you have not been working hard to secure a supply, but then there is a tight supply all over the world. We are not nitpicking, but you have to be more aware of the people's needs. We have a shortage of adult masks as well as young children's masks. Over 200,000 masks have been given out in Kwun Tong and Kowloon. We've also given out a lot of hand sanitizers, etc. But still, many people are telling us that they have difficulties in getting masks, in particular when classes are to be resumed. Many colleagues have been going after you, but I'm sorry, I didn't get any reassurance from you. You haven't given us any specific figures. But what about your mechanism of stockpiling on masks? You haven't told us anything about that. You need to come up with a mechanism. As we see that the shortage is going to be with us for a long period of time, you need to promote local mask production, in particular masks for young children. Otherwise, we are going to get an outbreak in the schools. And then for frontline workers, well, to be frank, they are at the front line. Security guards, cleansing workers, healthcare workers, etc. It is said that you are going to give out the masks to them, But the reality is they're still running short of the surgical masks. Can you not do the following? Can you, within the government, provide more masks to such workers? Now, for cleansing workers, they can't just do with one single mask a day because they sweat easily. And please be more caring and generous. Yes, you have a shortage of supply in relation to CSI masks, but can you not think of ways to provide more masks to the cleansing workers? Now, for the Hubei case, I know that there are many Hong Kong residents who haven't heard from you. They live in the peripheral areas of Hubei. Now, we may have a family of 4. Only the husband is in Hong Kong, and then the mother and children are all still being stranded in Hubei. So what are you going to do, and when are you going to extend a helping hand to them? For the SWD, now, people would like to get some counseling from your service units, but then you simply tell them the hard truth that you can't help them at all. But if you can't give any help in kind, can you not provide some psychological support? Secretary, please address the questions concerning masks. Thank you, Mr. Oh, for your questions concerning masks. We have a global shortage of masks, and other than in fact, our government logistics department is trying to source for masks globally for the internal use of the government officers. And in fact, under the anti-epidemic fund, we have said that money will be set aside to make sure that money will be readily available to source the masks in the international market where there is a fight for the masks. We have to keep a close look on the supply, and then members have said that other than adults, we have to pay attention to masks for small children. Perhaps we should look at the possibility of getting the production lines that would be able to manufacture masks for young children. And for our healthcare workers, as well as the hospital authority, they will continue to try hard to buy the masks. And then you asked a question about the Hong Kongers stranded in Hubei. Well, perhaps the CMAB can supplement. Yes, Ms. Chen, please. I think they're working hard to make the preparatory plans. Thank you, Mr. Chen, for your question. We are certainly concerned about the Hong Kongers in Hubei province. We understand that they would like to come home ASAP, but then we have to bear in mind the outbreak both in Hubei and Hong Kong, and also the capacity of our local healthcare system. In many places in Hubei, they are still having a lockdown, and transport hasn't resumed. Every time when we arrange for a chartered flight, we need to be very cautious, and we need to put in a lot of preparatory efforts. We'll continue to liaise closely with the Hubei provincial government, and we are having talks to return the Hubei, to return the Hong Kongers from Hubei on the basis of priority and by batches. Understand that if they need any help, for those who need any help, they have already contacted the Hong Kong SAR government. If you're aware of any case that hasn't approached us already, please ask them to do so. Counseling. It seems that even if they call the SWD, they can't get any help. Mr. Chen, you are responsible for elderly care, but can you answer this question? Well, I can try. If anybody is bothered or worried about the outbreak, you can go to your integrated family service centers, or you can call a hotline so that we can find out what assistance we can offer in the light of the individual circumstances. Secretary. The HAD can also help. Mr. O asked if we can help to address the needs of the citizens concerning masks. Well, the Home Affairs Department has been doing a lot on this front. In particular, when we receive donations, we have been handing out the masks to the frontline workers or others in the community that have the need for such masks. Yes, Ms. Chen, thank you for the questions. For the Home Affairs Department, at the district level, we've been appealing to well-meaning individuals and organizations to donate surgical masks and other cleansing items so that we can distribute them to those who are in need. So far, we have already handed out 5 million masks to those who are in need. We take into account the preferences of the donor, and we try to see how the charitable organizations can sort of help in distributing the items. Well, through the hospital authority, we can give the mask to those who are in high risk, and then for the charitable organizations, we have worked through Bảo良局, Thông Hoa, Port Oi, Lok Sin Thong, Yen Oi, New Arrivals Home, and Hong Kong Islamic Community Center, Mongkok Kaifor Association, patients groups, and also Street Sleepers Action Group. We've been working through them, so we are covering such people, and we cover all walks of life.
I'd like to thank, in particular, a charitable fund which has donated 2.5 million surgical masks. At the district level, as we say in paragraph 29 of the paper, the district officers in various districts have, through our district, scheme, have carried out, taken actions to distribute sanitation packs. We have also, enhanced the cleansing of hygiene black spots in the districts. Through public education, as some members mentioned, we have approached the minority ethnic groups. We've also sent out the messages from the Center for Health Protection through our support centers. There are 8 in total of such centers. Through these centers, we have disseminated the message to the ethnic minorities. Other than that, regarding the distribution of surgical masks, some of the recipients are members of the ethnic minority groups. So the HAB is actually working together with the rest of the government to provide support to fight the infection. For those people who require counseling service, once you require any request for assistance through our hotline, we will refer these cases to the SWD. Mr. Shukafai, thank you. I think the epidemic has caused serious damage to our economy. Public sentiment has also been seriously weakened. But it is unfortunate that the number of infected cases compared with other countries is still, one would say that the situation is still under control in Hong Kong as of now, as of today, which is the 10th of March. So I believe the policies implemented by the government and colleagues from different departments, thanks to the efforts, Hong Kong so far has been able to appears to be, in control of the epidemic. Early on, there have been a lot of arguments as to whether or not we should close our borders. I think people in Hong Kong would know that we have two different camps of people holding different opinions. When the ASEAN government said that we need to close off the Hong Kong-Macau ferry and the Lowu border control point, no one in Hong Kong objected. So I think we seem to have a consensus here. So we need to come up with. I think we are unanimous, but as to why is it that we have so much disagreement as to whether or not we should close off the borders totally. We have people scrambling for tissue papers and so on. Once people hear about such messages, people are scrambling even for tissue papers. There have been some disagreements earlier, but now I think we all agree on we agree to have on the same direction. We have sufficient supply of provisions in Hong Kong, so I don't think Hong Kong people should be divided. Otherwise, we will not be able to fight this battle. My question is that we are not closing off our borders totally. There are still people who are able to drive, come to Hong Kong, drive into Hong Kong from the mainland. I'd like to know whether or not there have been a single case of such people driving through the border into Hong Kong who have been found to be, infected. Mr. Siu, you are asking about the 14-day compulsory quarantine arrangement. That is people coming into Hong Kong from mainland. Now, every day you have several thousands of trucks carrying, provisions into Hong Kong. For the drivers these truck drivers, there have been anyone who have been found to be carrying the virus. I think for all the truck drivers, they are exempted under the compulsory quarantine scheme. I think the scheme itself, according to the present scheme, which has now been implemented, we have not had a single case of confirmed infection. Earlier on, I heard that the medical staff are now fighting the battle at the front line, and they have been complaining that there have not been sufficient resources. How true is that? Is it that we do have a shortage of these materials? I think for the HA, perhaps I can ask the HA to further respond to the question. They've said earlier that on the one hand, the resources they have on hand can last for 1 to 2 months. For some of the resources like the N95 surgical mask, there is a more serious shortage. Had there been any interruption of supply, there is zero supply. As of now, had there been any time when supply of such material resources have been interrupted? Had there been a time where medical personnel had any interruption or of these supply of these resources? No. You have many trucks carrying provisions into Hong Kong. There are many business people in Hong Kong who operate businesses in the mainland, which are still, in operation. So you have a 14-day quarantine requirement. Is there any way to allow these people to go to the mainland to take a look at the factories so that the factories can continue to run? They are worried that they may not be able to take care of the operations in the factories. For these people, can you allow for these people to go through a test so that they don't need to comply with the 14-day quarantine requirement and that they can return to the mainland? As we gradually resume the economic activities, we understand that there are different needs. In our interaction with the mainland, we have a system so that there are some exemptions which are allowed, and this is and the Chief Secretary is in charge of that. Regarding the latest development of the epidemic, I have several short questions. Today we have the Director of Logistics present. The public in end of January and early February, we're told that you have called for public tender for 57 million surgical masks, but I don't think there have been any update on that. Is it that you're not able to buy these 57 million masks? You are now going for direct procurement. Could you announce on your website the number of surgical masks that you have been able to buy? Because we have to ask each and every time. As of now, the public is very discontented because the government's dissemination of information is not very transparent. You're too cautious. Sometimes disseminating information may not cause panic. It can actually help the public better prepare for the situation. And secondly, there have been arguments as to whether or not the coronavirus could be incorporated under the scope of the occupational diseases. In earlier January, the government said that even if that's not the case, when someone is sick in the course of work, the employer has an obligation to provide compensation. The Labor Department said that it was considering whether or not they would need to amend the law to incorporate coronavirus into under the list of occupational diseases. Thirdly, for the situation facing the frontline cleansing staff, I'd like the Secretary to know that at the moment, CSI surgical masks are disseminated to frontline workers working for the FHD, but many members already pointed out that one mask per day is not enough. I think the department knows this. If the FHD, for staff working for the FHD directly, they are allocated 2 masks a day. For those working for the contractors, they only have 1. So I just want you to ensure that when summer comes, at least you should provide 2 CSI surgical masks for all staff working for the FHD. For the drivers and foremen, they are also working at the front line, but they are not issued CSI surgical masks. There are not many people involved here, so I hope the government will also involve them as well when you distribute these masks. There are many new duties to be carried out. For example, people need to collect garbage from those under home quarantine. I understand that the department is now engaging a contractor to do this kind of work. But for the units where people confirmed with the infection are subject to quarantine, you are now entrusting the cleansing to the contractors. I heard from the foreman that they say that they're very worried because the frontline staff, they only paid $37.50 per hour, and they didn't know that they have to do cleaning work in the premises where these confirmed patients are staying. So I wonder whether you can take these units out for separate treatment. So the first question is whether or not the novel coronavirus will be put under the occupational disease list, and also cleaning of the premises where the confirmed patients are staying. I understand the Labor and Welfare Bureau is reviewing the question, and perhaps they can supplement on the subject whether or not it could be incorporated under the list of occupational diseases. For the frontline cleansing staff, we understand their needs, and for the private contractors, they have a duty to provide surgical masks to the frontline workers. But we understand that it is very difficult to buy such masks at the moment, and that's why earlier we actually other than the workers working for the FHT, those working for the private contractors, we will also supply them with such masks. Of course, when the supply condition improve further, we will do our best to provide the support. What we do now is that the HAB would encourage people to make donations so that these material supplies could be distributed to those working on the front line. What about drivers? When the government's supply increases, or when we have more donations, or when production increases, we'll certainly consider doing that. What about the cleansing of the premises of the patients? I think other than the building itself, I think the FHD is also stepping up the cleansing of the vicinity of these affected buildings. For the Buddhist shrine in North Point, for example, the government is already stepping up the cleaning of the neighborhood there. I hope the Secretary will understand that you should have a separate tender for another contractor to do the cleansing work, rather than asking the staff of the existing contractors to clean the premises of those where the confirmed patients are staying. What about the 57 million masks that you said you would be procuring? Thank you. Early on in our public tender, we asked for the procurement of 57 million masks. The date for after we've vetted the bids, the contract was awarded on the 2nd of March already. So somebody did come forward to bid for the job. When are you going to make an announcement, or would you only make the announcement at the end of the month? As in the case of the Gazette, where you only make a notice every month. I think we will follow the usual practice, like when we make notice in the Gazette. So also the 57 million surgical masks, when will they arrive? The 57 million surgical masks, when will they be delivered? The one that they called for tender earlier. We don't have the information offhand, but I would like to say this. Mr. Chu asked whether we will disclose the number of masks that we have procured. The Logistics Department and the relevant departments have been we have been continuing to procure such masks globally. The problem is that while we have procured these masks, but given the development of the epidemic globally, some countries are beginning to impose a ban on the export of these masks and other materials. So right now, we hope that the masks that we have ordered for will arrive as soon as possible. Together with the relevant departments, we are now liaising with the we will first of all try to ensure that the materials can be imported to Hong Kong as soon as possible. We want to procure more surgical masks. While not all of them will arrive, but at least we would want to have more masks available in Hong Kong. Well, you told us that you're going to procure a large number of surgical masks. How many have actually arrived? Mr. G also wanted to know, you've called for tender for so many million surgical masks. You've already signed a contract, you've already made the payment, but you don't know when they will arrive. You say you're facing a difficult situation, but at least you can tell us how many units of these masks have already arrived in Hong Kong, rather than hiding the information. I think the government and the Logistics Department can consider this. That is, at relevant meetings, you can provide us more clear information regarding the number of surgical masks that you have bought and the number which have already been delivered to Hong Kong.
What about inclusion of COVID-19 as an occupational disease? We haven't got anyone from the LWB here. Can you not follow the example of SARS? If anybody was infected with SARS, it's a case of occupational disease. So it's a matter of when and how quickly. Otherwise, people may not get the protection. Yes, the LWB is working on it All right, that's it for today. Thank you.